story comes about because of a rash of ACL injuries dating back to Robbie Hummel last year. As far as reasons why an ACL would tear, any particular reason you can put your finger on?
Well, I don't know that I can say why we've had an increase here locally like we have, but there's a lot of people playing sports, especially girls' sports have become more in the forefront, and so with the additional people playing, there's going to be more injuries. I think that the speed of the game may have gotten faster in college and certainly in the pros. The preparation athletes make, you can strengthen your muscles, you can weight train and get your muscles super strong, but your ligaments don't get equally as strong. So if you're competing against other athletes that are bigger and stronger and faster, but your ligaments are the same quality, you're going to have a higher chance of having injuries. Plus, I think it's just a bad streak of luck that's happened locally.
What actually happens? I mean, if you can show on the model, we can get this from far away. When you hear he blew out his ACL, what exactly is that?
Here's a model of the knee. So that's the thigh bone, and that would be the shin bone. The kneecap would be right here. There's a group of ligaments that are represented by these springs. And what happens in an ACL is several things. One is you plant and cut, and if you do that very quickly, the thigh bone comes off the top of the shin bone, and it tears that ligament right here. This ligament just comes apart. Anybody who saw the videotape of Robbie Hummel probably was a little sickened by that, but it was a good example of the plant and cut that he did that caused that ligament to tear. In football, it can happen where your foot's planted, somebody hits you from the side here, and you tear not only the ACL, the anterior cruciate ligament, but also the ligament along the side there.
That's what we saw with Keith Smith.
Keith Smith, medial collateral. He tore the medial collateral, the ligament on the side of the knee also. So the knee kind of opened up and went like that, where the thigh bone and shin bone completely came apart.
Medical advances, I mean, you've been doing it since '87. It used to be a guy blows out an ACL, career's basically over with. The changes you've seen in medical technology where not only can you get it operated on and come back, but you can come back about where you were at as far as athletics are concerned.
Certainly. The things that have been revolutionary would be, number one, would be the rehab for it. The rehab's been such an advancement. It used to be when you tore the ligament, we didn't know exactly what to do, and when we did a surgery, we immobilized it for 6 weeks or something afterwards. Now we know what to do, and we do the rehab very quickly with it right away. The other thing is the arthroscope, where you can see inside the knee and diagnose the damage and correct the problem arthroscopically. Means there's much less trauma to the knee, and the knee likes that. The knee recovers much more quickly because of that. Other factors, there's screws and different ways that we fix the new ligament that we're putting in, the tendon that we put in to replace the ligament. That's more of a technological advancement where we can solidly fix the new tendon we're putting in to replace the ligament that's torn.
Difference between a good ACL surgery and a bad one. I mean, a lot of it is, you're not exactly going to know what you've got until once you get in there, but a difference between who you go to, a good surgery, a bad surgery?
Well, ahead of time, usually we'll get an MRI, so we've got some idea, but there are some times you get in there and you find something you didn't expect to find. So a good ACL surgery, in my opinion, would be one that you do arthroscopically, where you're seeing exactly what the damage is. And then what we do is we drill a hole here that comes out on the top of the shin bone, another hole there that comes out in the thigh bone. And we take a small strip of tendon, a piece of tendon between the kneecap and the shin bone. We take that piece of tendon and then we arthroscopically slide that tendon into the knee. That way we're seeing inside the knee accurately. We've got a arthroscope attached to a TV camera, so you're magnifying everything and you're putting that hole where you put the new tendon in the right place. And so I think by doing that and then fixing it properly with screws or some kind of a strong fixation method is very important to get a good result out of an ACL surgery.
Other things you'd like to make known, maybe something I may have missed in the interview process here?
Oh, with what's happened with Robbie Hummel, I have a lot of patients that come in and say, oh, that's not going to happen to me, is it? And I just would have to tell them that it's very unusual. Probably 1% of patients that tear their ACL will tear it a second time. And usually that's years later where they have like a second injury or major injury to it there. But in most people, the tendon that we put in is thicker and stronger than what was torn, and we do the surgery in a way that we make more room for that tendon, so the chance of tearing it again once they've fully rehabbed and gotten the ligament healed is pretty slim. So I just would see patients recently and tell them, go out and play as hard as you can. Don't worry about what was done a year or two ago, your knee should be solid. And the most common thing I would see someone for would be an injury somewhere else, their other knee, their ankle, somewhere else, rather than the ligament that we fixed in their knee.
So Hummel's case, one of those freak things where it happens again?
I suppose it is. You know, I'm not his doctor, so I don't know exactly the specifics of all that, but I suppose it's a unique thing. So, okay.
Phenomenal. And then if we can continue talking, we can get.
Close up.
I don't know if you need to get closer, Nate.
I went in and out sometimes on the interview.
Okay.
Just when he was really describing it. So I mean, but I was mostly out. So
Okay.
if you want to maybe do another little demonstration with it.
Like the actual plan I thought was fascinating. We'll have what you're doing with the model along with Hummel's video from when he was up in Minnesota.
Perfect. Beautiful video, yeah.
And if you can show again as Nathan's zoomed in on the model there, when he planted and the kneecap slid.
All right, so here would be a model of the knee. This would be the thigh bone, and then there would be the shin bone. The kneecap is right here. What happens is the leg is planted. This bone slips off the top of that one. Can I use the other model?
Yeah.
Let me use the other model.
Yeah.
I tell you why. This model used to fall apart, so I fixed this. I did a little. I fixed this so it didn't fall apart. That one falls apart. One day in July, I was at home. My wife's going, "What the heck are you doing?" I said, "I'm fixing the model. The ACL's out."
I blew my ACL model out.
See, whereas this one's real sloppy like that. Yeah. So you ready?
Yep.
So here's another model. This is the thigh bone, and that'd be the shin bone. The kneecap is right here. These are the ligaments that hold it together. There's one on each side of the knee, then two inside, the ACL, the anterior cruciate ligament, then another one in back, the posterior cruciate ligament. What happens when you tear your ACL is you plant and cut, and what happens is the thigh bone comes off the top of the shin bone. So this will kind of go like that, and that'll come off the top of the bone. When that happens, that'll tear the ligament, that'll tear the structure that connects those two bones together. Another way would be like what happened with Keith Smith, the Purdue wide receiver, would be your foot is planted, and in football, clipping is illegal. You get hit from the side like that, and the knee goes sideways like this. It'll tear the medial collateral, which is the ligament that connects here to there, as well as it'll tear the ACL right there. There's other mechanisms, a hyperextension mechanism where you know, in girls' sports sometimes, you know, the coaches, like your dad, teaches them to plant, just to stop and not take that extra step that gets called for traveling. Well, when you do that, if the girl's off balance a little bit, they plant their foot like that and don't want to take that baby step and all, and what happens is the knee hyperextends and bends backwards.